The Department of Medical Services is committed to taking care of public health and life, with a focus on complicated diseases. There are 32 medical facilities under supervision of the department, including those in the Bangkok metropolitan area and the outer provinces. The Department of Medical Services has upgraded its service to apply innovations in the form of cutting-edge equipment and expertise more extensively, adopting the mission of the best for the most. The department is undertaking reform policies aimed at 4 aspects. Function reform aims to change the role of agencies under the Department of Medical Services toward knowledge and technology transfer to regional health administration areas, promote clinical research, and improve skills and knowledge for medical personnel, including organ transplant, bone marrow transplant, heart disease treatment, and cardiac catheterization. Agenda reform intends to address serious health issues in the country in cooperation with other sectors. Some of the issues are as follows. To deal with the aging society, the department has developed its screening system, data management for transfer, and an all-in-one national database of the elderly with dementia. Regarding cancer, the department is planning to complete 100% pre-screening of colonic carcinoma among the vulnerable groups by 2022. To address chronic non-communicable diseases, the national database of stroke patients will be created to prepare for its occurrence and minimize casualties and disabilities. To cope with drug addiction, the department aims to promote people participating at community level and develop a more systematic care. In terms of area reform, the Department of Medical Services has established regional medical service offices in 13 regional health administration areas to promote and improve the capacity of hospitals in each area. For example, development of Chalerm Prakiat Hospital Group and Crown Prince Hospitals include renal care clinic, dermatitis clinic, and cataract surgery clinic. Specialized medical fields have been improved according to specific local needs, such as sending pediatricians to Si Sangwan Hospital in Mae Hong Son Province and cardiologists to Saraburi Hospital. Lastly, the system reform involves a development of human resource development that monitors staff enjoyment in their organization, promotes quality of life, and allows staff to work more happily. The digital system reform aims to develop smart hospital from the start to the end of medical services, including appointment, registration, reservation, non-paper prescription, and fee payment. The Department of Medical Services does well to maintain its good performance standard. Some of the remarkable achievements are as follows. It has introduced a shortcut for acute coronary syndrome patients that contribute to a lower death rate at the hospital by 10%. Developed the one-day surgery by suggesting and transferring the surgery procedure with 10,000 patients volunteering as samples. This project saved up to 660 million baht. The department enjoys great success in curing 188,000 patients with blinding cataracts, with proactive services in the provinces with a shortage of prosthesis, artificial legs and arms. A total of 2,375 disabled persons have received appropriate treatments. The Department of Medical Services is preparing to launch important projects. The MOPH Medical Complex is a pilot project co-invested between the government and private sectors. In the future, patients will have more choices of healthcare facilities, easier access to modern treatments, and encounter fewer crowds in public hospitals. The ASEAN Center for Active Aging and Innovation will operate according to the government policy as the coordination center to improve human resources and services at the ASEAN region level. The Innovation Center for Active Aging is responsible for providing the services to older persons to develop health-related innovation and extensive planning of aged care. Also, the Department of Medical Services is planning to provide training and certification service for clinical application of cannabis extract so that patients receive appropriate amount of the extract for optimal benefit. The manual of marijuana extract for medical purposes will be made available to public about cannabis. The Department of Medical Services puts the safety of patients on top of the priority to maximize survival rate and improve the quality of life for Thai people. These are the best reward and the value that we have been holding on for a long time.
ดูแลด้วยใจหายได้ด้วยเทคโนโลยี เย้